Good morning, everybody. Thank you guys for all coming today. On behalf of the Ada County Victim Services Center, I'd like to welcome everybody who is joining us today as we proclaim the month of April as Sexual Assault Awareness Month. I would especially like to acknowledge our survivors of sexual assault, our community, our elected officials, and our collaborative partners. My name is Trina Allen, and I am the Executive Director of the Center. And I love seeing all the teal today. So welcome. I'll keep my remarks brief because I want an opportunity for all of our amazing leaders to have an opportunity to share the meaning of Sexual Assault Awareness Month. Each one of our individuals who are speaking today have a very important role, whether it is pushing to change legislation to better support crime victims, investigating reports of violence, or providing resources to support those who have experienced sexual assault, whether you're an adult or a child. Each speaker will share how their team or area is working to provide the best service to those who are most in need. But the work goes beyond just who we have speaking here today. You'll notice that there are many banners from various organizations today, from law enforcement and partners across the Treasure Valley who work with survivors of abuse and assault. This proclamation is not just for Ada County. This proclamation is for the state, to let all Idahoans know that we will stand against sexual assault and support survivors on their journey of healing. So it is my greatest pleasure to introduce Governor Little, who will read the proclamation for proclaiming April as Sexual Assault Awareness Month. Thank you.
Well, thank you, and again, to everyone that works on this issue, all the hard work they've done, the collaboration. Big things don't get done if a lot of people don't work together, and particularly if they don't care who gets the credit for it, if you're doing the right thing. I do appreciate all the partners, and one of the things that we did, thank you, Colonel, is the sexual assault nurse examiner position at the Idaho State Police that we funded last year. That means there's going to be one more person dedicated statewide to help educate nurses, medical professionals on the best way to work with victims of sexual assault. And as in all of law enforcement, and particularly in this area, good quality training and awareness is incredible, because if people have confidence in the law enforcement and the other people out there, that means they'll come forward. Confidence in government is one of my highest priorities, and there's no area where it's more important than it is in this particular field, to break the hesitancy of making a statement when a statement needs to be made. There should be no acceptance or tolerance for this crime in our communities, not in Idaho and not anywhere. So with that, I have an official proclamation from the Office of the Governor. Whereas Idaho is committed to drawing attention to the prevalence of sexual assault and raising public awareness about sexual violence and prevention through education. And whereas sexual assault, rape, sexual harassment, abuse, and assaults are widespread problems that happen in all communities in this great state. And whereas in the United States, nearly 1 in 5 women have experienced a rape or attempted rape. Nearly 44% of women and 25% of all men experience some form of sexual violence in their lifetime. And 1 in 6 boys and 1 in 4 girls are sexually abused before age 18. With these numbers consistent in Idaho. Whereas Idaho is committed to educating our communities about what can be done to prevent sexual assault and how to support survivors. And whereas Idaho strongly supports national, state, and local partners and citizens in actively engaging in public and private efforts, including conversations about what sexual violence is, how to prevent it, how to help survivors connect with services, and how every segment of our society can work together to better address sexual violence. And whereas Idaho firmly believes in sexual assault nurse examiner training and developing sexual assault response teams in local communities and training law enforcement officers on proper response and investigations into these crimes. And whereas timely rape kit processing and tracking is critical, so justice can be sought for victims in thorough investigations which are aided by accurate and timely forensic science that results in convictions or exonerations of individuals as they work through the criminal justice system. And whereas the state of Idaho condemns sexual assault in all its forms by encouraging every person to speak out when witnessing acts of violence, however small, and we support the goals of educating Idaho residents about sexual assaults awareness and prevention. Now, therefore, I, Brad Little, Governor of the state of Idaho, do hereby proclaim April 2024 to be Sexual Assault Awareness Month in Idaho and encourage Idaho citizens to recognize its special observance. Signed, Brad Little.
Thank you. I would like to welcome Meridian Chief Basterchea to make his remarks. Thank you.
First of all, I'd like to thank everybody that's here. This is a pretty amazing gathering of people, and I'm very honored to be here representing our law enforcement agencies in this valley. We are very, very fortunate to work with one another and to truly not care who gets that credit. We've been very fortunate that way for several years, and it just keeps getting better and better. And with that, as the governor had mentioned, law enforcement has come a long way in how we investigate sexual assault cases. We've come a long way in how we interview and treat our victims. And we've come a long way in how we cross jurisdictional lines and how we work with community organizations to make the process hopefully as less victimizing as possible. But what we're doing now just isn't enough. We need to be better about educating the public about what sexual assault looks like. We need to do a better job of investigating and prosecuting these cases. And we have to remember that we can always do better. We need to do more in the arena of sexual assault prevention. While law enforcement can provide safety tips, we aren't the ones with the greatest ability to impact this issue. It is truly a community effort. We, as parents, as leaders in our homes and our communities, have to be better about educating our sons and daughters about how valuable they truly are. We need to emphasize each other's worth if we are going to be a strong and healthy community. If we can raise healthy, respectful sons and daughters, they will be healthy, respectful adults. And I think we can agree we need respectful adults right now in our society. As leaders, we have to model the behaviors we expect from our community. Sexual assault has had such a negative effect on too many lives already. So let's work on making those lives impacted by it better, by leading by example. Thank you very much. Next, I'd like you to welcome Taylor Cook from the Nampa Family Justice Center.
Good morning. It is an honor to be here with all of you this morning. So my name is Taylor Cook, and I am the Human Trafficking Task Force Manager for the Nampa Family Justice Center. The Nampa Family Justice Center's mission is to promote safety, self-sufficiency, hope, and healing to those that have been affected by abuse. In December of 2021, the Nampa Family Justice Center received a federal grant that gave us resources to assist victims and survivors of human trafficking. This grant funding allowed for the Nampa Family Justice Center to expand service provision and provide direct services for victims and survivors of human trafficking to include housing support, mental health support, substance use treatment, transportation, food assistance, and more. This funding also allowed for the expansion of training and education on the topic of human trafficking to make our community members and professionals more aware of the realities of what human trafficking really is. In September of this last year, the Nampa Family Justice Center and Idaho State Police were co-awarded an additional federal grant by the Office for Victims of Crime that has provided funding to enhance the Treasure Valley Human Trafficking Task Force. The goal and hope of this task force is to continue increasing identification and services to victims and survivors of human trafficking, to increase investigative capabilities through the support of law enforcement and our prosecutors, to hold traffickers accountable and to reduce demand, and to promote further training and education on the subject of human trafficking. We at the Nampa Family Justice Center recognize that human trafficking is a multidisciplinary issue, and combating it effectively takes all of us. The Treasure Valley Human Trafficking Task Force is made up of local, state, and federal law enforcement, local and federal prosecutors, the Department of Health and Welfare, probation and parole, local victim service providers, and more. Over the last few years, we have made significant strides as a community in acknowledging and identifying human trafficking as an issue in our state. We have a long way to go, but we are making strides in the right direction. I am encouraged by the professionals that I have the opportunity to work alongside of who are passionate about addressing and fighting against this horrific crime and injustice, and I'm encouraged by the progress that we're making. We're all here today because April is Sexual Assault Awareness Month, and today I want to highlight the intersection between sexual assault and human trafficking. Traffickers commonly use sexual violence as a tool to exert power and control over their victims. Victims and survivors of trafficking can experience sexual violence both by their traffickers and by those that are purchasing sex. Because of the stigma that surrounds the sex trade, sexual assaults are largely underreported and often undervalued. Sexual assault and sexual violence are also common for our victims that have been trafficked in labor, those that are working in restaurants, in domestic work, agriculture, and more. We also know that a significant number of our trafficking victims and survivors have a history of child sexual abuse. This trauma history is just one way that traffickers will take advantage of their victims in subsequent exploitation. So what can we do? We can start by acknowledging the issue, which is what we're all here doing today, and by believing survivors. To all victims and survivors of sexual assault and all the other associated horrors like domestic violence and human trafficking, we say today that we see you. We create space to really look at the issue and to see the survivors that are impacted by this every single day. What else can we do? We can continue to have conversations with our communities, with our families, with our coworkers, and we can continue to spread awareness. Awareness is the first step in making a difference. At the Nampa Family Justice Center, we are committed to working together with our partners. We're committed to continue growing and learning, to helping to create innovative solutions to mitigate barriers for our victims and our survivors. We're committed to holding on to hope and to creating, providing, and fostering a safe, supportive, and healing environment where victims and survivors of human trafficking and sexual assault can feel seen, heard, and safe. So on behalf of the Nampa Family Justice Center, today we say that we stand with victims and survivors. We will be a safe place, and we will continue to advocate and fight on your behalf. Thank you. And now I would like to introduce Dr. Amy Barton, the medical director with St. Luke's Cares.
Good morning. One of the things that Taylor did not highlight is how rare those grants are and how fortunate. Jeannie, how many do we have in the country? 2 or something? 4 awarded, and we have one of them in Idaho, so I think that's important to point out. Good morning. It's an honor to be in a room with this dynamic group of individuals with shared goals. As most of you know, this is also Child Abuse Awareness Month. Perhaps the designation of April, the same month, for both child abuse and sexual assault awareness is not by chance. Statistically and practically, there is a massive overlap in the occurrence of these crimes within homes, families, and individuals. Centers that provide comprehensive family-based care to both adults and children who have experienced these crimes are the epitome of trauma-based patient care. Nationally, these comprehensive centers are rare, just like our grant. The Treasure Valley has the good fortune of having 2 of these amazing centers, the Nampa Family Justice Center and the Ada County Victim Services Center. Being a child in Idaho is a storybook dream of idealism for some children. Idaho is a beautiful state with gorgeous scenery, clean air, and really kind people. However, for some children, being a child in Idaho is a life of squalor, violence, and fear. Unfortunately, due to a variety of reasons, it is increasingly difficult to protect these children. However, we can recognize the hope we have in the state of Idaho through the Idaho Network of Child Advocacy Centers. Idaho is fortunate. We have 6 accredited child advocacy centers, 1 associate member child advocacy center, and 1 developing child advocacy center. Child advocacy centers provide a safe, neutral, and peaceful environment for children and teens to talk about abuse they may have experienced or traumatic events that they may have witnessed, such as a homicide. Our child advocacy centers have highly trained clinicians to address the mental health needs of the child, as well as systemic needs of the family. Our child advocacy centers have highly trained physicians, nurse practitioners, and physician assistants to provide medical care to these children and teens. Children and teens have very real anxieties about their bodies and their health after experiencing child abuse or sexual assault. Our medical personnel have the expertise and knowledge to address not only these concerns, but other health problems which are not a direct result of the abuse or assault. These services are critical to not only the health of the child or teen who experienced sexual abuse or sexual assault, but also to the health of that child's community. Children and teens who have experienced child abuse or sexual assault have the fundamental right to know that they are physically healthy. Being reassured of physical health allows this child or teen to focus on their emotional and psychological recovery rather than worrying about a physical health concern. During this month of increased awareness of child abuse and sexual assault, I challenge all of us to increase our awareness of the children and teens we encounter in our lives. This includes not only the children and teens in our own families, but their friends, our neighbors, the children in our churches, and in our social organizations. Listen to what those children and teens are telling us with their words and their actions. Pay attention to the adults around those children and teens and the way adults interact with those children and teens. Question any concerning adult behaviors you may observe. Most of all, know that there is hope and help in the 9 child advocacy centers in our beautiful state with highly trained, compassionate, licensed clinicians, nurses, physicians assistants, nurse practitioners, and physicians to provide immediate trauma-informed care to these children, teens, and their families. And now I would like to introduce Anne. Anne is over the Safe and Sane program here in Ada County, and she's just really a phenomenal person and introduced me to my dog, and I thank her forever for that.
Thank you, Amy. In the aftermath of sexual assault, survivors are often faced with a journey that requires not just physical care, but emotional support to navigate the trauma. Without proper care and support, trauma can manifest into chronic medical conditions and mental health issues. Here in Ada County, we have a specialized team of nurses that provide medical forensic exams for victims of sexual assault. Sexual assault nurse examiners, or SANEs, have advanced educational and clinical preparation to respond to sexual assault patients' physical and emotional needs. SANE programs like ours in Ada County have made a profound difference in the quality of care provided to sexual assault survivors. Receiving care from a trained and experienced SANE increases positive health outcomes and improves access to additional resources. Many communities also experience an increase in guilty pleas and prosecution rates when sane documentation and expert court testimony is provided. Victims of sexual assault are often reluctant to come forward and report the assault to law enforcement, but are willing to seek medical attention. SANE programs provide victims an opportunity to receive medical care with or without reporting the assault to law enforcement. Victims receive medical care at the center without judgment or shame. A SANE provides holistic, patient-centered, trauma-informed care that empowers and reassures victims that they are in a safe, secure environment where they will be cared for. SANEs are extensively trained to provide emotional support, conduct physical exams, identify and document injuries, collect evidence, provide necessary referrals for aftercare, and provide expert court testimony when needed. I have been honored to lead and work alongside a team of nurses that are highly skilled, compassionate, and dedicated to giving victims a safe place to be heard, believed, and cared for. It is inspiring to work with colleagues who view this work not as a job, but a call to care for some of our most vulnerable. Ongoing support and treatment after a medical forensic exam is crucial to a victim's recovery. Having multiple resources available for victims at one location allows for a warm handoff from the scene to a counselor, advocate, or law enforcement officer. One of our partners in the building is the Women's and Children's Alliance, and I would like to introduce Bee Black. She is the CEO of one of the most comprehensive crisis programs in Idaho that supports both domestic violence victims and sexual assault victims. Bee Black.
Thank you, Anne. As I listen to all our speakers this morning, I am filled with gratitude that we live in a place where there is so much support and obviously caring and passion for victims of sexual assault, and so much willingness to stand together, starting with you, Governor, to raise awareness. It has been my privilege, and still is, to serve as CEO for the WCA. And I just want to mention, while our formal name is still the Women's and Children's Alliance, I use our initials as we strive to help our community understand that we don't just serve women and children. We serve all, including men. Somehow when you hear women's and children's, you don't necessarily as a man think that we might offer services for you as well, but we do. With the mission of providing safety, healing, and freedom, we have a wide range of services to offer. I want to highlight that our 24/7 hotline is our most used service. Last year, our specially trained client advocates took 4,470 calls. Of those, 185 were sexual assault-related calls. During the first 2 months of this year, 49 were sexual assault-related calls. Now, when we look at the average per month number of sexual assault-related calls, that's an increase of 67%. However, you heard the numbers that the governor mentioned. That's not enough calls. We know there are a lot more individuals who are out there and who have suffered sexual assault. We work hard every day to invite those who have been traumatized by sexual assault to reach out. But we know, as has been mentioned before, that it's very difficult because of the shame, the stigma, and the victim blaming and the self-blaming that occurs. When they do reach out, we are able to offer so many services, including crisis counseling and support groups. Being located here is allowing us to work towards doing an even better job of ensuring that the individuals that Ann sees and others within this building see, that they get that crisis counseling as soon as they reach out. They may not reach out more than once. We also meet survivors at the Ada County Courthouse through our team of court advocates who can be found there as well as here, assisting with civil protection order filings and providing safety planning. Just last year, our court advocates helped with 1,912, and that's just civil protection order filings. Already during the first 2 months, they have assisted with another 293 filings. Again, they are connecting individuals with the rest of our services. All the services that we provide at no cost are very comprehensive. We include safe emergency shelter, we have longer term counseling, we have case management, licensed childcare, and financial empowerment classes. But as a community-based service provider, I would say that one of the most important things that we do is outreach. Outreach with an intent to educate our community and also to encourage survivors to reach out for support. I am so pleased that this year we have several new ways that we are raising awareness. Some of you may already have seen, thanks to Lamar Advertising, we have 6 billboards. I can't tell you how excited we are about that. 6 billboards along the freeway providing information and encouragement to survivors about reaching out to our hotline. Today, we have many partners, including Ada County Courthouse, City Hall, and the Ada County Victim Service Center, as well as law enforcement partners that are turning the town teal. So look for the teal lighting. One more new initiative is our Bandana Project, designed to raise awareness of the prevalence of sexual assault, specifically among our farm workers. As in years past, Stinker stores are starting their Piece of Hope campaign, which starts April 8th. And given the location of their stores throughout our state, they help raise awareness and funds for organizations like ours. And finally, towards the end of the month, April 24th, we encourage you all to wear denim. I was hearing that Denim Day is one of the favorite days over in, many locations where typically you have to, wear your suits or your uniforms, right, Chief? But raising the denim is just another way to raise awareness. And several of our speakers today have said, that is one thing that each of us can do, is we can help raise awareness. So there are so many ways, large and small, that we can show victims of sexual assault that we hear them, we believe them, and that we are here for them. So thank you so much to each and every one of you. You all play such a huge role in helping survivors and helping them find their journey to healing. So thank you for being here. And now I get to turn things back over to Trina.
What a special day, and I am touched by everyone that has spoken today, but I'm even more touched by all of the support we have in this room. I know that many of you do this work every single day, and so I'm inspired by you. And Taylor, when you said, we see you, we do. We see the victims out there. And we know that we have more work to do. We know that we can be doing a better job, and that's what we're working towards. So today, as you guys all go out and continue to do your very best, please know that we support you. We want to do better, and so make sure that we're all networking and we're collaborating and that we're being very transparent so that we can make a difference, because our children and our adult victims deserve it. So please take the time to network with each other. We'll take some pictures. We have some cookies and coffee. Take just a couple of minutes and really get to know your partners that are in this room. Thank you.